Yes, sir. Now it is live, so we can continue. Just a second. Yes, please. Sorry for interruption.
Okay. Can we go to the next slide, sir? Yeah. What are the mainstreaming strengths of Siddha medicine? This is very, very important. The people who are coming to Siddha have an easy accessibility than that of a Western medicine. But it doesn't imply to a meaning that Siddha doctors are of huge time. That is not the point over here. The accessibility for an the waiting period to see an allopathic doctor and to a waiting period to see a Siddha doctor as a different value, and they are very easily accessible, and you can the patient feel more more friendly as he has been given an apt time to discuss, because the basic of Siddha understanding itself goes by the nature that being a physician, I want to know the entire the 96 basic principles getting documented in my history, and we will take little more time than that of an individual. Usually in my hospital, even we have around 200 cases per day, which is being seen by 6 doctors, but it will take at least 2.5 hours for them to path the patients between themselves. And what is the out-of-pocket expenses? The today's world is looking into the out-of-pocket expenses spent by an individual. And if you compare that, it will be more economical, which I will also cover in the later part of my speech. And the less technological, the investigations made over here are not too much costly, because many a times patients come to a Siddha physician with all the diagnostic part done. And there is a quality called as patriotic or native. It gives them a strong, immense feeling that they are taking the medicine of their own land, and claimed to be less side effects. But I little differ from this. The side effects caused are low, and people used to say that Ayush drugs will not create any side effect. No, I'm going with the law of Newton. If anything gives an effect, definitely there should be a side effect. Next slide, sir. But what are all our weaknesses? Our weaknesses, yes, I should accept my weakness also, because when we are going to speak about our newer horizon, and we want to speak about what we want to further improve more, there still needs standardization lacking happening, because we now have ended in one herb and one standard. But earlier, we had all the standards of PLIM. Still, there are drugs which need more number of standards than the existing standards. For an example, I will say that Siddha has a specific higher order medicines called as Kattu, Kalangu, Urukku, Chunnam. All these drugs are very, very unique to Siddha, and no, it's not available in either Ayurveda or Unani. So the PLIM guidelines were not drafted for these drugs. If a company like our JRK sir is there, if he wants to deliver to a patient of making a drugs of this kind, say for these drugs can be used in cancer, then the standardization part we need to improve, and we should draft all those. And we have an efficacy data, but this efficacy data is lacking in its originality, because if I want to export, I hope JRK is the only company who has a high number of products having an HCN codes, and it's very, very important to have that. The efficacy data, if we produce only, our drugs could be exported to all the foreign nationals. So it's very, very important for us to improvise more in the efficacy data. For an example, I could say you that the recent example is Kabajora Kudinir. When we were doing a good point of efficacy, when we were proving the safety of the drug, and also when we have included good number of RCT, which is the other point, we get a permission nationwide to distribute. That is the strength of a drug, any drug. So all these points should be taken into account, that you should have a standard drug. The drug should have a good efficacy data, a good safety data, and it should have been subjected to more number of RCT. I to understand, doing RCT for every single drug is tougher. But if you want to expand to the global, if you want to do something in domestically, then that is okay. But if you want to expand to the globe, then definitely you need to do more number of studies. Can we go to the next slide, sir? Yeah. What are the mainstreaming opportunity? The mainstreaming opportunity says about the rising paradigm shift. We have a definite footfall increase towards AYUSH streams. And we have a data stating that 9% of the total population of Tamil Nadu and all the other region come to SIDDHA for healthcare needs. See, this data is from both the allopathic and the government private practitioners data. Definitely, there is a paradigm shift, and this paradigm shift is rising day by day. And government readiness, government is now ready to include AYUSH streams in the national health policy. Yes, definitely, it's a welcoming move, and we are now getting more number of expansion boundaries, more number of hospitals are coming up with the help of the support of the government. But the readiness of the government is an opportunity for us. We have available policies are in our hand. We have good AYUSH DCP is available, AYUSH GMP is available, AYUSH related good agricultural and cultivation practices. We have a lot of policies which will help us more. We have a acceptability from stakeholders, from all the stakeholders. The scientific community, if you take 3 decades back, the scientific community was little rude because they wanted more number of standards. Now, scientific community itself is coming forward to help us. So it's the stakeholders' acceptability is very, very improvised, and it's an opportunity. And we have a rising research data, which definitely helps the possibility to mainstream. See, Tamil Nadu is a place in which you have a co-located SIDDHA centers along with allopathic clinics. And it's very, very important that both these systems integrate with each other so that mainstream will become possible, and the patient will be the person who will choose what system he wants. Next slide, sir. See, as I said earlier, we have protocol for testing, which has been published by respected Dr. Lohar, and it was a very good document. Still, there is a scope for improvisation of this document, and definitely stalwarts should sit together and do this. And we have an AYUSH guidelines for particularly for animal studies, and which has been published by Central Council for Research in Ayurvedic Sciences very recently, which is a very good document which is in place. And we have an AYUSH DCP, we have AYUSH GMP, and we have a National Accreditation Board of Laboratories QC lab standards. We have NABH hospital quality standards. I am an NABH assessor, and I used to do assessment based on these policies. And we have NAC, that is Educational Quality Standards for Educational Institutions. I am also a NAC assessor, and these policies are already available in place, which will help us to move further. Next slide. Yeah. Then what is the uniqueness and what happens? See, integration has always already taking place between systems. This is a publication in which Rasagandhi Melugu has been reviewed by Ayurvedic physicians, and they have said that this Rasagandhi Melugu is very good for patients who is suffering from benign or malignant tumors, and this reduces the panic of surgery. That's a very, very important point. If we could intervene a patient in his earlier stages of cancer, that is in N1, M1, that is there is a small nodular formation and metastasis is happened just now. In these conditions, we can treat the patient with a SIDDHA drug alone. But if it is T2, M2, then it should be, the option should be an integrative. However, This drug, Rasagandhi Medu, has tested for many type of cancer. And this publication has been written my fellow Ayurvedic professors who have been doing this for a very longer period. So it's the integration has already taking place. And this Rasagandhi Medu is a very good drug, which has also been tried in HIV by our late physician, Professor C.N. Devanayagam, as came with a therapy called as Rasagandhi Meduga, Amukara Churadam, and Nellika Lekium, which is combinedly called as a RAN therapy. And this RAN therapy has given a very, very good quality of life improvement to the HIV patients in the combined therapy along with the allopathic drugs. So it's very, very important to know how we can, this happened very recently in the, when HIV came into prevalence. So it's very, very important to know what we can do to the society in a bigger way. Next slide, sir. See, Varmam is a science which is very unique to Siddha, and it has its own abundant literature in Siddha medicine. And Varmam has been now the factor for increased footfall. However, COVID has stalled its growth because Varmam needs a tactile sensibility, because a doctor is supposed to touch the patient. And since it comes into a closeness, we have been doing Varmam not straightly, but using some other prevention in between. So Varmam can be applied in no time, and it's a stimulating treatment for many ailments. People used to say that it's for chronic diseases. Even in acute conditions, Varmam used to help you. See, for dental pain, many dentists who have taken training in Varmam, they are using Varmam points for reducing the dental pain. For if there is a severe pain, they are pressing some points which will definitely reduce the pain, feeling alleviation of a patient. So it's very, very important to learn Varmam and to practice Varmam, and this is going to take Siddha to a next level. See, I will show you the next slide, how it has been traditionally having a sound knowledge. In this next slide, you can see that we used to do a CPR. CPR is a point in Varmam called as Uyirnilai Adangal. Uyirnilai Adangal is a point which, when stimulated, will increase the functionality of the heart. Whenever there is a failure and whenever a patient goes to a coma, we used to give a BLS, that is basic life support, using this cardiopulmonary resuscitation. This has been quoted as Uyirnilai Adangal, and it's located, the anatomical location is also been quoted. So it's very, very important to have this in the platter of Siddha. Next slide, sir. See, I said earlier, I will also say the cost. See, the treatment cost is very much affordable. See, the National Institute of Siddha is having a session called as Karnul therapy, which is also available in many Ayurvedic institutes as Shara Sutra. But the interventions which has been used in Siddha, Karnul, and Ayurveda Shara Sutra are entirely different. The interventions, the medicines which has been used as threads are entirely different. And you can see that the out-of-pocket expenses cost due for a Karnul patient is very, very low that of the patient who is going to undergo a fistula in ano surgery in an allopathic hospital. So it's very, very important. See, I can give another example. If a Siddha physician want to treat a COVID patient, the total cost, if he is admitted even, does not have crossed more than 13,000 rupees for a period of 10 days stay. But in an allopathy counterpart, it will be more than 3 to 4 lakhs. There are two things. That is, we treat only mild cases, I agree. Even for a mild case treatment in allopathy, it goes between 50 to 75 lakhs. So the out-of-pocket expenses to a patient is always affordable. Can we go to the next slide, sir? Yeah. This is a very, very important point. We used to say that the validation, scientific validation gives strength. This is a paper which we have attempted to test the saying in Siddha that Kadukai ki ahananji. That what they used to say is, if you take Kadukai along, that is terminally a chebula, along with its seed, if you take chebulic myrobalance, this is going to reduce the good effects of terminally chebula. So we have proved it via a testing in which we have tested the alkaloidal content with and without seeds, and our final results have been proving that in the sample with seed, the flavonoid and alkaloidal content which and the phenolic composition was very low in the Terminalia chebula sample with the seed. So when the seed is removed, all the goodness increases. So it's just a validation for the scientific for the saying in Siddha in a scientific manner. Next slide, sir. See, this is about H1N1 pandemic happened in the year 2016. In the year 2016 to 17, we started our research using Kabajora Kudinir. And so the repurposing of Kabajora Kudinir from H1N1 has happened. We'll see, only for to make you aware that we have done a research with VIT Vellore, stating that how this Kabajora Kudinir, Nilavembu Kudinir, and one another drug called as a novel formulation called as Jacome has an efficacy over inhibiting the neuraminidase, which is a culprit in the H1N1. And we have proved that these three drugs have a potency to inhibit. So in the year 2016-17 itself, Kabajora Kudinir has been extensively used by government of Tamil Nadu, which is available in their public health annual reports, that Kabajora Kudinir has been employed in H1N1. Having this in our hand, we suggested this to the Honorable Prime Minister as a repurposed drug. As happened in an allopathic way, we have taken this as a repurposed drug, and Kabajora Kudinir came into existence. Next slide, sir. Yeah, this is a publication. It has been cited many times. This publication says that how the cells pre-treated with Nilavembu Kudinir, a cell which has been pre-treated with the Nilavembu Kudinir, doesn't allow dengue related virus to enter inside this cell. This is very important. There are two scenarios there. We have pre-treated and post-treated. We have found that the pre-treated effect of this particular drug is enormous, and it's highly evidential and strength, which has been published in this paper. So this was the evidence which we have did in a reverse pharmacology style, because Nilavembu Kudinir has been given very earlier from the chikungunya period, and in 2017 and 18 there was a very huge criticism stating that people are taking drugs into the public health platform without any support. So our team have entered an MOU with ICGEB, and we have been doing this in a very better way. Next slide, please. Yeah, this is the first evidence which has been created in the month of May 2020. Every one of you will be knowing that the March 2020 we faced the lockdown, and this is the first evidence given to the government after repurposing Kabajora Kudinir. Government expected at least a minimal evidence to go with the Muri guideline, and it happened via this. So this is the first evidence created for Kabajora Kudinir in COVID. Next slide, sir. This is once again this publication has proven that how the antiviral activity of COVID is there in the SARS-CoV-2 virus. The antiviral activity has been proven, and it has in the E6 cells we have proven it, and we have a control also from an allopathy control we had, and we have used that allopathy control towards testing this drug. So it's very, very important to create evidence in this newer edition to prove that our statements in AYUSH are always evidence-based. Next slide, sir. See, if you go back to the literary knowledge, you can see an evidence for nano. Not only Siddha, even in Ayurveda and also the potency forms of homeopathy, we try to triturate our medicine to its lowest level. So you can see that there is a saying in Tirumandaram about the atomic theory, and this has been quoted by later by Avayar, who is a poetess in Tamil Nadu and who has acclaimed a lot of treasure, knowledge treasure, and he has said that அணுவை துளைத்து 7 கடலை புகுத்தி குறுகத் தரித்த குறள். It says about, she took an example from Thirumandaram and from the atomic vision. She is taking an example and quoting it for the lines of Tirukural. Tirukural is having 2 lines, and she is saying that Tirukural is like a weapon which will divide the atom, and which will accumulate all the 7 C's inside an atom. So piercing the atom and pack within the 7 C's of the world was, even though it was a dream, but it happened, because all the drugs which we use in Siddha exist either in a nano or a near nano range. Then what is the use of this? And what neurohorizon has us to deliver for a patient? Neurohorizon is that what if we could attach a molecule which will target a cell line or which will target a tissue, then it will become its own prey. Let us see in the next slide. Can we see next slide? Yeah, this is the nano form of Linga Chanduram and Purna Chanduram. Both of these drugs are very good in treating cancer and also are very good in increasing immunity even at COVID times. So it's very important to know that a drug which is nano in range could be given in smaller doses for a particular period with a higher efficacy. Have it, it's very, very important for our friends to have it in mind that whenever your drug has becoming narrow, then the drug may have more toxicity. So it's very, very important to have it in mind that a drug which has its reduced potency will be more toxic. So you adhere with all the dosages. See, you can see dosages set by the Siddhar Thereya. When you take preparations based on him, the dosage will be the amount of drug which falls in the beak of a crow, and 1/8 part of that should be taken. A beak of the crow will always have 100 mg. The 1/8 part of this will be among that calculation within 20 mg and all. So the dosage should be very lower because the drug is already in a nano range. Next slide, sir. Yeah. See, there are 2 theories in nano. One is top down and another one is bottom up. If for top down, I can say you the Churanam as an example. You take a macromolecule, a bark or a wood, you pound it and you make it into a very, very, very minute particle. You take the case of Triphala. Triphala can fly in the air. So we are trying to make it into a minute particle. That is the top down method. And in the bottom up method, all the sublimation process used in Siddha, as in the forms of drugs called as Padangam, in which the combined drug will go as vapors and it will be settled in the part used for the preparation of the medicines in a very minute form. And this form happens to become a nano form, and it's very, very important to also understand. So these are all the 2 areas even nano follows, but it's already existing in the traditional system of medicine, the 2 in Siddha. Next slide, sir. Yeah. This is one another study which we have done to assure the weight variation characters and the disintegration. See, we have 100% true, we have traditional drugs, but if we want to take up our traditions, Siddhas have done what their might in the earlier day. It is the responsibility of Siddha officiants like us, like me, to carry to the world. So when we did a market survey, between the Kuligas and the tablets available in the market, we found that there exists a weight variation and disintegration time variation. And also, if you the time given for Gugulu is more or less 1 hour, 60 minutes, if I am right, as per the pharmacopoeial standards. And but the marketly available certain Gugulus disintegrate very fastly. So all these make us to make up a project, and we did a project in which we analyze the quality control parameters for, especially for disintegration and weight variation. Study has been conducted with the marketly available drugs and the prepared drugs, which we did in our pharmacy. And in the end of the day, we concluded that it's very important to go away with the modern parameters for tablets to make it acceptable to the international standards. Next slide, sir. Then this is a very important point about the earlier study which I have said. This is a very, very important publication done by Tarakan et al., which has been published. This is about the toxicity study of Rasagandhi Meduga. And this has given a very great importance that it has shown that how the HIV patients have been treated. And you can see that continuous administration of the RGM, even you shall see, none of the books have told us to continuously administer. We have been advised to do a drug holiday, 15 days, give some other medicine, and after that only start. So continuation has not been recommended in many books. So it's, however, these studies proven that RGM is little safer than the expectation that it may be, it may not be safety. So that there comes the knowledge of the Siddhas, in which they have used a technique called as taking mercury, making it blending with sulfur, in which they make a Ganjali, and this combination becomes less soluble, and however, it acts in a very super form. So it's very, very important to know this. Next slide. Yeah. This is about the RCTC. In the earlier slide, I said that we have a lot about challenges in doing RCT. During COVID-19, we have three very, very important trials which has happened. One trial happened in Stanley Medical College, in which we have two drugs, that is vitamin C and zinc versus Kabazorokudinir, and there we have tested how many days it has been required by a patient to get himself discharged, and what are all the symptoms reduction. And we found that the patients who had taken Kabazorokudinir were discharged little earlier, as they become negative very faster than the community which has been taking vitamin C and zinc. It's because of two things. One is the antiviral property of this drug, which did not allow the virus to replicate itself. Then because vitamin C and zinc has to play a role with immunity. I'm not underestimating vitamin C and zinc, definitely not. It has helped to many of the people in a bigger way, but the outcome which we had is the discharge date, and discharge date becoming RT-PCR negative was little later in that category. And then we had one another study in government hospital, government medical college, Theni, in which we had both. We had a vitamin C and zinc group, and we have vitamin C, zinc, and Kabazorokudinir group. There also we found that the Kabazorokudinir treated arm has a quicker discharge. And this is very, very important study which has happened in JIMS Noida, in which we have taken this drug Kabazorokudinir, and we have compared it with that of Kabazorokudinir, then one another drug Nilavemkudinir, and green tea with that of the regular standard allopathic care. So we found an integrating opportunity over there, and we ended up that saying that people who have been in the arm of Kabazorokudinir with the regular allopathic treatment have a very shorter duration of the stay in there. So it's very important to take traditional medicine and making it strengthen only by the way of doing a randomized control trials, in which you have a 2 or 3 categories which will give more focus and more attention towards our study. Next slide, sir. To conclude, the newer horizons have expanded from the year 2006, because from the year 2006, we had SIDDHA is usually branded to be more efficacious in non-communicable disease. There is no doubt in that. Still, if you take the top 10 diseases treated by an AYUSH hospital, will always have an NCD in the topmost priority. But it's to reassure that we have a lot of potentials also in communicable disease. And now the research in SIDDHA is expanding as more number of stakeholders own traditional medicine as their own. Yes, more research is yet to come, I understand, and more newer horizons should be taken. So in the SIDDHA Day, I am reaffirming that our traditional knowledge will be, sir, can we go to the next slide, sir, if available? We will reaffirm the traditional knowledge, and thank you, sir. Then we are very, very much happy to say that SIDDHA has a new horizons in treatment, and it will reach more population in a bigger way. Thank you for giving this opportunity to share some of my scientific knowledge with this August gathering. Thank you, sir.
Thank you. Thank you very much, Doctor. Thank you very much. You have explained everything in very broad. Excellent. Excellent. Agnihotri, sir. Professor V.K. Agnihotri, sir. Professor V.K. Agnihotri, sir, is from Haridwar. He is ex-head of the department, Uttarakhand Ayurveda University, Department of Swasthya. Welcome, sir, for your comments.
Thank you, Professor Pawan Sharmaji. Namaskar. It's our great pleasure that we are celebrating our SIDDHA Day. And fortunately, we have got a very staunch personalities belonging to this very discipline. Otherwise, we are always scared that SIDDHA persons are not available to us on daily basis. At least one person we feel, and we will feel honored if one representative of SIDDHA section or discipline will be here with us. So it will be a great exchange of the views. So as far the Satya Rajeshwaran sir presentation is concerned, it was so deep and so informative that we were never known to these facts that SIDDHA is working this much, simply because we are belonging to North India, and here it is preparation by JR's Reddy sir, preparations were there. Very good preparation were there, especially this person who was visiting us way back in 1995. But the way it's approached, say physiologically, pharmacologically, and pharmaceutically, this has been well informed by our Professor Satyaji. So in this way, any person who plans to visit North India, it's our request that either at the center of Professor Pawan Kumar Sharmaji, say Mansarovar Global University, or to our Uttarakhand Ayurveda University, we will feel pleased to have your guest lecture and be benefited with our so many say desirous students, MD scholars, PhD scholars with your view, so that we will be having a bridge between SIDDHA and Ayurveda and all that in a practical manner. We have a knowledge and we feel ourselves attached with SIDDHA, so it will be a rather renovation.
Sir, yes. Thank you for the invitation, sir, and definitely I will come. Don't worry, sir.
Yes, sir. That will be our pleasure. Thank you, sir. Thanks. Great pleasure of your presentation. Thank you, sir. Over to Pawan Sharmaji.
Thank you. So now I would like to request Rajgopalji. Rajgopalji is Managing Director of Dr. J.R.K. SIDDHA, the product of which company is a specialty company, no doubt. And we are using their products right from 40 years and excellent results. J.R.K. SIDDHA is especially renowned for skin products, and which we are failing in our North India, and the products are excellent. So without wasting much time, I would like to request Rajgopal JK, Dr. J.R.K. SIDDHA, Managing Director from Chennai. Welcome. Welcome, Doctor. Welcome, Rajgopal.
Thank you very much, Pawanji, and first and foremost, thank you for organizing this session exclusively for the National SIDDHA Day. I'm very honored to be there today amongst all of you, and I must once again compliment this wonderful series of conference online series you've been having. This is definitely going towards probably a global world record, I must say, or already it has reached. This is an outstanding service which you are doing, all of you, along with your colleagues, doing a wonderful service for the Ayush system. And I think this effort is something that will be definitely, as you mentioned earlier, कि सालों साल रहेगा और हमारा हम सब जाने के बाद भी रहेगा. तो ये सर्विस आप करते रहिए और यंगर लोगों को भी आप इंस्पायर कर लीजिए ताकि ये एक it will become a habit for exchange of such use and the platform. Thank you once again without further loss of time. आज का टॉपिक है पवन जी, कल शाम को, कल दोपहर को आपने फ़ोन किया था, तो I was very happy and was immediately honored to take it up. The topic for today was diet and nutrition in Siddha. So with your permission, can I share my screen?
Yes, you are co-host, sir. And topic is not limited for you, sir. As per your wish, we are eager to listen.
Okay, wonderful. Is my screen visible?
Yes, sir.
So, Siddha diet and nutrition for a healthy life, that's the topic. And let me tell you upfront, I'm not a Siddha physician, but I had the honor of introducing and facilitating the research within our company and manufacturing and marketing the products coming from the Siddha system across the country. And it's been a wonderful journey for us in Dr. JRK's research. And I'm very happy to have colleagues joining us from all systems across the country. And just for the information of a colleague in Haridwar, just very recently we have had a small representation in Haridwar. So I'm definitely advise my colleague to come and meet you and share some of the details of our company.
Thank you so much.
Yeah. So I think across the world there is a fatigue for unhealthy food. We all, unfortunately, in the last 20, 30, 25 years have fallen prey to so many kinds of food, not only coming from within our country, but most importantly coming from elsewhere in the world. The lifestyle of people have changed in both metro and non-metro cities. But fortunately, in the last few years, there is greater awareness of going back to nature, and that's where our Ayush systems have a great opportunity in reintroducing to the Indian and also to the rest of the world what our systems of medicine have profited as food. I wanted to share this as a kind of an opportunity which is there in the nutrition global market, and where Ayush, all systems, whether it is Ayurveda, Unani, Yoga or Siddha, can come in and take a share. And very happy that the government of India has taken up this, the ministry has taken up Ayush Ahar and Siddha Unavu Porutkal, which is Siddha's food, will definitely have a future to play. So global nutrition food, just for nutrition food market, is valued at $5.4 billion, and it's expected to grow to 11.08. I mean, इतना सारे crore है जो हम गिन भी नहीं पाएंगे कि इतना people are coming into this segment. People are continuing to grow, and the natural food segment is valued at nearly 9,84,000 crores. So different statistics are there. All that I would like to say is that it's huge, and therefore something that is very much available to all of us. And what kind of problems are being addressed through this kind of nutrition market or food market, natural food market is allergic disorders and bone and joint disorders, diabetes, even cancer, and not as medicinal but supporting food, infants, and also the maternal. So the kind of ingredients which are mentioned are usually the dietary fibers, fatty acids, minerals. ये सब हमारा सीधा food में या तो आयुष food में है. Only thing is we need to present it in the language that people understand. That is the thing. Therefore, the huge business opportunity is there. Waiting for the world waiting for the world to listen to is the noise from India, particularly the Ayush sector. India maybe it is not very far. The Indian dietary supplements food is also very huge. Organized sector itself is around 37,600 crores. That's the research done by one of the research groups. Or this market is expected to explode to 85,000 crores. So massive market, and इसमें से एक छोटा सा शेयर अगर आयुष सेक्टर लेगा तो that is itself is a big thing, and I'm sure with the kind of impetus given by government and the opportunities which is there, and already people have started valuing this, the day is not far off when we see many companies coming forward. Dr. Rajeshwaran, Dr. Satyarajeshwaran mentioned about the rising burden of non-communicable diseases. That is really alarming situation in India and also in the rest of the world. Majority of the population in some form or the other are unfortunately affected by huge lifestyle disorders, and consequently, apart from medicinal expenses, there is a lot of stress in the families. But I think the biggest thing that is driving this unfortunate lifestyle disorders is the lack of proper diet, and that is where our systems of medicine, if taken to the people in the right way, can make a huge difference in the cost of management of so many disorders. Dr. Satyarajan mentioned about a simple difference, a simple of course I wouldn't say simple, but nevertheless COVID was a problem, and the kind of expenditure which people incurred, poor people incurred, was massive and huge, and the differences in the cost of treatment as was shared is almost 4 to 5 times, and therefore with a good healthy diet and nutrition coming from our own systems, definitely the overall cost of life and the cost to the government, particularly in managing many disorders and the kind of traffic which is going to the various scan centers and other things, definitely that can come down. So solutions for lifestyle diseases and better diet are very much within our Siddha and Ayush systems. I'm sure Dr. Satyarajeshwaran and Dr. Kannigavelan will agree that in Siddha there is a very simplified, straightforward communication. Unave marundu, marunde unavu. Food is medicine and medicine is food. The beauty of this system is that the food and diet actually is customized to the individual. Today, unfortunately, whether it is a restaurant or not, everything is standardized, and food is there. There is hardly any consideration for the individual's constitution. Yes, you get medicines which are tailor-made for a particular person, but food, definitely not. And therefore, people are eating, with due regards to them, people are eating high cholesterol food, unhealthy food prepared in unhealthy conditions. All the consequent damages in their vital organs are very much visible in a very, very short time. Younger people are falling into lifestyle disorders. So in Siddha system, I'm sure the experts will bail me out. A lot of customization. It is customized. Food can be customized to the season, whether it is winter or summer season or rainy season. There's a certain kind of food which is prescribed based on the terrain, whether it is a mountainous terrain or a coastal area or agricultural flat terrain or forest, different environment conditions, the food prescription is different, and of course the individual health conditions. So actually it's a very scientific, very systematic way of prescribing a proper diet and nutrition, and every practitioner follows it. But the only thing is, it needs to percolate down to the Aam Aadmi. How it will percolate to the Aam Aadmi? Because the biggest constraint which Siddha practitioners or any Ayush practitioner is patient compliance. As a manufacturer, we see that doctors do communicate, but patient compliance, if it is not there, then even the best of the formulations may not be able to deliver the required therapeutic efficacy. Just as a matter of discussion, Dr. Satyaraj mentioned about Kabasura Kudinir, which I think all of us are fortunately aware. But preparation of that, it's a pada churna. Preparation of that involves boiling, filtering, cooling down, and taking. In today's modern world, people don't have the time to do that and do it consistently during the treatment period, and therefore after one or two times, unfortunately, they may dilute or they may postpone or they may just not follow it. And think of lifestyle disorders where they may need to do this continuously for a long period of time. So somewhere we need to see how it can be customized. I was mentioning about Siddha's way of presenting different types of food for different situations, considering the body condition in these weather conditions. This is one example how the season-based dietary conditions can be, dietary recommendations can be there, and accordingly the patient or the normal people can take up diets. But in our current lifestyle, we don't really look at it. We take every food and anything, irrespective of whether it's winter or the burger is being consumed right through the year. The colas are being drunk right through the years, and then oily and spicy foods are being consumed right through the years. With due regards, we take chole bhature, we take samosas, we take, all these things are definitely somewhere we are making the mistakes. So we need to see how the Siddha system has actually conceived several thousand years ago the right kind of food for different seasons, different terrains, and all these are very well documented. It just needs to be brought forward to the knowledge of people and also to the use of people. That's the point I would like to highlight, that it needs, there is enough material available, and it is not at all difficult for experts to go through it. But what is important is to bring it out to the people for their day-to-day use, and that is how the system of medicine will penetrate. So the huge opportunity is there for Unavu Porutkal. Siddha Unavu Porutkal is the equivalent of Ayush Ahar food. Already we are seeing, because people, as I said in the first slide, already we are seeing the proliferation of health food stores, organic food stores, natural food stores in so many urban areas and also in non-metro cities. It is a real plus point that people have become more conscious, and the Western world is becoming even more conscious of the kind of additives which are going into food. And this is where I see there is a explosive opportunity for the experts in the system as well as the manufacturing and the research enterprises to bring out uh, customized and also ready to consume diet and supplements which are coming from the system, because this, when we are able to touch the day-to-day life of people, naturally the system of medicine and its benefits will also start getting attracted. So we have a great opportunity. The chain of reach to the general public is only getting better with the advent of such stores. And as far as specifically Siddha system is concerned, it has been a great acceptance of the system. And at Dr. JRK's research, we had the uh, blessing of medical practitioners across the country and also across the world to gracefully accept the Siddha formulations and give the necessary encouragement for us to continue our small journey in the research and development of the Siddha system. So the Nilavendu Kudineer, which was for dengue, and Kabasara Kudineer Churnam for the COVID and respiratory disorders have been uh, greatly accepted and widely distributed. And in addition to the success in the treatment of skin disorders and autoimmune disorders like psoriasis. So Siddha system is definitely has got a lot of things to share, and the government of India is also uh, gradually increasing the public health services open to the general public, particularly from the Siddha system, and including the Honorable President of India, their state is having a specific outlet for Ayush, and within that for Siddha. So very honored, and therefore the reach of Siddha Unavu food is only going to have more and more opportunities. Here, I think the regulatory environment needs to get more precise. Unfortunately, the word Ayurveda or Siddha is, or Ayush is being loosely used. So the opportunities have been already seized by the FMCG multinationals, and therefore we don't really have true or 100% coming from within Ayush Nahar or Siddha Unnamapura duly licensed. It's still a long way. We have many food products, many products which claim to have an Ayurvedic ingredient. If you really look at it with the microscope, probably you'll have not 1% of that ingredient, and rest is all the thing that is not anywhere near prescribed from the Ayush system. So I think the regulatory environment requires a closer watch. I'm sure work is being done. Another thing I would say is to make it available in contemporary forms. The diet and nutrition, including Ayurveda, needs to be made it available in contemporary forms. Means to reach the public. You know, people do not want their current speed of life necessity. It should be ready to use. It should be safe. It should be having a good shelf life. All these are important. You know, it's not that we can cook food and give to people and expect them. Yes, home food is the best, but even within home, there are enough ingredients which we are all currently using that comes in a pre-prepared way and available for instant use. So it needs to be available in contemporary forms. Just to give an example, we in our company, Kabasara Kudineer and Nilavendu Kudineer, we have come out with a ready-to-drink form, and we found great acceptance of that because people have to just add warm water, stir and drink, as against boiling, filtering and drinking, which is time consuming and can also result in poor patient compliance. We have done the HPTLC studies, we have done the confirmatory studies to ensure that the properties of the original Siddha formulation is nowhere diluted, and the active ingredients are available in the same proportion in the ready to drink version as is in the original. So this is just one example. Like this, if in food also, if it is in ready to consume forms, in packaged and presented in a form that people begin to include it in their day-to-day life, that will be a great thing. Uh, Today, people outside eating out is a common thing. हम लोग सब हफ्ते में एक या दो बार, whether we like it or not, but the family pushes us to consume, go out and eat. And we have friends, we have families, we have get-togethers, we have weddings. ये सब में many places, public places, I would request through this platform to the government and Ayush Ministry and entrepreneurs and doctors who can influence to have Ayush food courts in public places. That's where we can increase the visibility of our health foods and the diet and nutrition coming from our own native systems, Ayush systems. I'm sure you all have heard of cloud kitchens. E-commerce is becoming a way of life. People want to order things right in their home online. Today, a youngster can just sit at home and get everything he or she wants, and it is all in the laptop. अब आजकल कोविड के कारण सब लोग वर्क फ्रॉम होम कर रहे हैं, तो वर्क फ्रॉम होम में इतना काम करता है कि कहाँ जाके कुकिंग करेगा किचन. So e-cloud kitchens have come, and definitely there is a big opportunity to have customized food tailor-made to that person's individual constitution, which can come from a Siddha or Ayush food on order. Instead of ordering unhealthy food, there is a huge business opportunity of ordering well evaluated, well prepared Siddha Ayush food coming with proper nutrition. So I am sure the market is going to open up for that. And huge export opportunities are there for Siddha food and dietary supplements, including Ayush. Not only with the Tamil diaspora, because people are waiting to hear from India as the big brother. So huge opportunity for export can come. And in some of the recent visits outside India, I've seen that when we talk about medicinal products, the first question people are asking is, do you have any food supplements? Do you have any dietary supplements? So the world is waiting. There is enough text material available. All that is required is to convert that rich knowledge to make it available for the general public in a form that can make them part of their day-to-day life. So I'm very happy to say that at Dr. JRK's research, we are getting ready to do the research and already done some small evaluations of some of the Unavu Porutkal, which can aid the management of some NCDs, non-communicable and autoimmune disorders. I hope the time will come very soon that we will be in a position to play a small role in bringing about the rich benefits from the Siddha system into the, particularly not only from the treatment and drugs, but also from the Unavu Porutkal food for the betterment of our mankind. So I end this with this small message. And thank you once again, Dr. Pavanji, and also all the team members of the wonderful Independent Research Ethics Society and AYUSH SAMRIDDHI for organizing these kind of events. And over to you, sir. Thank you.
Thank you, thank you, thank you. We would like to listen your blessings for your products also. because you have unique concept of skin disorders, what we don't have in any company. I was in Jandu for 33 years, Imami and Jandu. But I really salute your Padma Shri founder, really salute, because they have means concentrated and focused on the unique subject, what we don't have. So please guide us regarding background of those.
Thank you. You want me to say about it now? I'll be happy to. Okay.
Yes,
Thank
yes,
you.
yes.
I was not prepared, but I can talk about it even in the sleep.
Yes, yes,
So,
yes, yes.
yes, sir. Thank you. So our products, our research has been focused on the Siddha based product formulations for the management of skin diseases like psoriasis and vitiligo and eczema, and we are also looking at how the immune modulatory requirements are required are needed to be managed in these conditions. And very recently, we had the success in introducing a very novel formulation for the management of diabetes and comorbidities. First time in the world, we are in Ayush company, and also possibly, I think with modesty we can say about other systems, we are focused on a single drug management for the entire spectrum of requirement for diabetes management, right from managing the blood glucose levels and also most importantly the organ protection. So we have introduced D-CoD tablet, diabetes and comorbidities of diabetes, D-CoD tablet with a lot of research. We have done a complete clinical research comprising of nearly 300 patients and also covering the cell damage inhibition by this drug, SIDDHA drug, for retinal cells, neuro cells, kidney cells, and liver cells. So the entire gamut of comorbidities forming part of the long-term side effect of diabetes patients. So it's a very well researched. Nearly already we have published nearly around 25 publications in this product only. Overall, as a company, we have nearly 200 research publications in journals of repute, both India and outside India, covering various topics: uh, safety, mechanism of action, and clinical efficacy. So, ये सब हम इसलिए कर रहे हैं कि हमारा जो मेडिसिन है, जब डॉक्टर्स प्रिस्क्राइब करता है कि पहला सवाल क्या है, ये मेडिसिन सेफ है, काम करे न करे, सेफ होना चाहिए, पहला कोई नेगेटिव चीज़ नहीं होना चाहिए. तो हम पहला चीज़ हम कोई भी ड्रग इंट्रोड्यूस करते हैं, रिसर्च करते हैं कि सेफ्टी नॉट ओनली फ्रॉम क्लिनिकल साइड बट फ्रॉम लैबोरेटरी एवेल्युएशन. और उसके बाद ये अगला सवाल डॉक्टर्स क्या आता है, ये कैसा काम करता है, आपका कहने से नहीं होगा, ये कैसा काम, मैकेनिज्म ऑफ एक्शन. सो we do a lot of research on how it works and why we claim what we claim. So mechanism of action. Our last is of course clinical efficacy. Yes, theoretically the product should work, but finally it should work on the patient. The clinical studies are there. काफ़ी स्टडीज हम पब्लिश कर चुके हैं कि CTRA registered clinical studies covering psoriasis, vitiligo, diabetes as I said, and many other indications which are so जो कुछ हमारा लेवल पे हम कर सकते हैं we are doing. And again हम with a lot of modesty I can say हमारा जो products है सिद्धा as drugs, as drug, ये बहुत important है कि as a drug विदेशी में रजिस्टर हुआ है. मलेशिया में हमारा डॉक्टर JR के 777 ऑयल फॉर सोरियासिस, इट हैज बीन रजिस्टर्ड एज अ ट्रेडिशनल मेडिसिन. हमारा एक डैंड्रफ का प्रोडक्ट है, वो रजिस्टर हुआ है ट्रेडिशनल मेडिसिन की तरह. और बाकी काफ़ी कंट्रीज में, मॉरिशस में रजिस्टर हुआ है, श्रीलंका में रजिस्टर हुआ है, फिलीपाइंस में रजिस्टर हुआ है। ये सब में नॉर्मली people go to such countries as cosmetic products or food supplements, but we have taken the effort to register the products as drugs which are required for the, so ये effort हम ले आए। और अगर सोरियासिस के बारे में बात करेंगे तो हमारा 30-40 साल का एक हिस्सा है। तो एंटायर स्पेक्ट्रम ऑफ मैनेजमेंट ऑफ सोरियासिस के लिए हमारे पास प्रोडक्ट्स हमने डेवलप एवॉल्व किया है कि हर एक requirement of management of psoriasis, not just clinical symptoms, but also the day-to-day lifestyle requirement, right up to a cleanser which is required for the management of psoriasis. The soap है, scalp psoriasis के लिए shampoo है। तो for the doctor who is going to manage the patient, he or she can address all aspects of the management. Similarly for vitiligo. So our research journey is continuing, and we are really blessed to have the support of nearly 20,000 medical practitioners across the country. It is still small, but hope we are one of the few SIDDHA companies, or the first SIDDHA company to reach across the country, right into the Assam and even Meghalaya in the eastern side, up to Rajasthan on the western side, and right up to Jammu and Kashmir on top of India, and of course to Kanyakumari on the south. But a long way to go. We are very honored to have the warm support of AYUSH practitioners, irrespective of system, coming from Ayurveda, Unani medical practitioners, and most also from allopathy practitioners. ये जो हमने सवाल हमने पहले जो बोला था कि सेफ है कि नहीं, मैकेनिज्म ऑफ एक्शन, आयुष डॉक्टर्स तो सब लोगों को मालूम है कि ये इंग्रेडिएंट्स देखते ही उनको मालूम होगा कि ये इसके लिए है, और हमारा स्टडीज के दौरान और भी कॉन्फिडेंस होगा। लेकिन जब हमारा आयुष प्रोडक्ट्स एलोपैथी डॉक्टर्स लेंगे, उसके द्वारा आयुष का अभी काफ़ी डॉक्टर्स, ये घर की बात है, काफ़ी डॉक्टर्स आर ओपन टू alternate medicines and they are willing to listen. I appeal to all Ayush practitioners to have healthy debate with allopathy doctors. We should not engage in who's better. I sincerely request through this platform, कभी कभी कुछ प्लेटफॉर्म्स में ये डिबेट होता है कि हमारा बेटर है, सब में एक अच्छी बात। आयुष इज वेरी गुड फॉर, definitely well known for chronic disorders. There are huge advancements in acute disorders in regard to allopathy. I think there is a very good opportunity to collaborate, integrated medicine approach. So when we go there, we are forced to explain science. उनका language में हमको बताना पड़ेगा। So we are going with that as a step, and Government of India is also very keen to bring in scientific way of taking Indian systems of medicine forward, and they are playing a small part, and we'll be very happy to play bigger and bigger role. And I do not want it to become like a marketing talk, but I'm very happy. Thank you sir for giving this extra time to talk about what we do. I'll be very delighted to meet all the through our colleagues who are there across the country, and as and when जब भी मौका मिलेगा आप सब लोगों को मिलेंगे। पवन जी, आप तो आपका सपोर्ट तो था पहले से। I must say apologies for not meeting you for so many years. I will meet you in person and definitely extend this relationship. Thank you very much.
Thank you. You have the unique specialty that you are using minimum ingredients and you are treating the higher level diseases. Maybe eczema, maybe psoriasis, maybe dandruff, but ingredients are very less. This is also unique concept. Excellent. And we are using from last 35 years. After passing MD, I am using that same. Really, I have
Thank you.
treated various psoriasis cases due to your products only.
No, no, no. It's
And,
all.
and along with only blood purifier from Ayurvedic side.
Yeah, thank you, sir. Thank you. We are honored. And of course, with your knowledge, these drugs are reaching the patient. That is the biggest blessing for us. The well wishes of so many patients who have been benefited by the treatment of Ayush doctors and our products is a blessing for us. And we wish to carry this blessing as a guiding force for our betterment. Thank you.
Thank you. We would like to invite you and your experts both to Mansarovar Global University. We have 3 Ayurvedic college of 100 seats each in Bhopal. And Bhopal is only the city where 15 Ayurvedic colleges are there in one city. So we are eager to meet you. And Professor Agnihotri sir is there in UK, Uttarakhand. And now we have joined Harish Verma ji from Canada also. So I would like to request Professor V.K. Agnihotri for his valuable comments.
थैंक यू प्रोफेसर पवन शर्मा जी, नमस्कार। पहले तो हम ये कहेंगे कि डॉक्टर मिस्टर राज गोपाल जी हिंदी बोलने में बहुत कंफर्टेबल हैं। इन्होंने जो पहली बात जो शुरुआत की स्टार्टिंग पार्ट इनका हिंदी में रहा, जो हम सब लोगों को बहुत अच्छा लगा। हम लोगों ने कल ही अंतर्राष्ट्रीय हिंदी दिवस मनाया था, और आप जैसे उद्भट विद्वान भी अगर साथ में रहो तो हमारी सिद्धा का आयुष का यश जो है वो भी जिंदाबाद हो जाएगा।
हमारा हिंदी बहुत बेसिक है। अगर आप इसको अच्छा करेंगे तो और भी सीखना है बहुत। लेकिन एक आई एम हैप्पी दैट आई हैव बीन एबल टू कुछ बात कर सकते थे हिंदी में।
नहीं, जब हिंदी से चेन्नई से जब हिंदी आती है तो वो कंफर्टेबल वालों की आती है। कल हमारी डॉक्टर हेमा मालिनी जी भी जुड़ी थी, हिंदी में बहुत ही अच्छे से बोले। खैर, दूसरी चीज जो आपने मैंने जस्ट यू कंप्लीटेड योर प्रेजेंटेशन, so what I found that so many good preparations of least ingredients are there in Siddha, and especially working on the skin disorders. We have also used some of them, but still my quest remains that is there any specific diet and nutritional instructions pertaining to a particular disease that would have been a better touching to our today's topic of webinar. Say for liver disorder, along with your preparation, could you recommend something specific as a diet or nutritional value?
I hope Dr. Satyaraj is there today. Is still there, Doctor?
Okay, okay.
We would like to welcome answer from Satyaraj.
Sir, can you repeat the question, sir?
Our idea is that we are still interested to have some dietary and say nutritional diet support recommended by Siddha's system of medicine. Along with the disease person, or as a preventively as per the seasonal variation, because that is our site of specialization. So we are always eager to know more and more regarding the preventive side of the health of every individual. Yes, please.
Sir, I can say you using this. In Kerala, you have a habit of giving Karkadaha Kanji, that is the porridge, special porridge in the month of June and July. Likewise, in Tamil Nadu, we have a habit.
What we can understand in Hindi or in for North Indians?
Sir, it's porridge, sir. Porridge. That is Kanji.
दलिया बोलते हैं ना, दलिया
it should be dalia made up of some special ingredients as Karkadaha in the month of June and July. You should start in Kerala, but in the month of April and May, when the summer is in peak, as a preventive therapy, here we used to give the dalia made up of ragi, which will definitely cool your body and also have a habit of increasing your immunity. You may be
this ragi crop is there in your site.
Yeah, sir. Actually, in Tamil Nadu, Tamil Nadu is a place where we have only crops which will grow in a with a lower water content earlier. Then after rice became our staple food, we have forgotten these millets, and being international year of millets, we are replenishing it back for our uses.
Right.
So there are a lot of recipes. If you want, I can share some material also to share. Okay.
Excellent, excellent, Sahib,
We
excellent.
will invite you again and again for getting this sort of knowledge, because
Yeah.
in one day or in 1 hour cannot be completed our all quests. Thank you so much
Thank you.
to both the speakers.
Thank you,
Over
sir.
to Pawan Sharma ji.
Thank you very much, sir. Thank you very much. Now I would like to request Professor Harish Verma ji, President, Canadian College of Ayurveda from Toronto, Canada. Ontario, Canada. Welcome.
सर जी नमस्कार।
Welcome, Harish ji. Welcome.
सभी आचार्यों को प्रणाम। नमस्कार।
Pranam, pranam ji, pranam.
तो डॉक्टर राजा गोपाल जी, can you highlight your diabetes medicine? Can you put the name in the chat? And what is the active herb you are talking about diabetes and its comorbidity?
The name of the product is D-COD tablets, D-COD tablets, in a short form for diabetes and comorbidity of diabetes. And this drug is mainly indicated as a supportive drug for management of diabetes, because there are enough formulations available for the bringing down the blood sugar levels. Our focus has not been just the blood sugar level, because there is more to diabetes than just blood sugar level management. So we have done the research and to prove that this drug as a whole is effective for the management of protection of the organs mainly. So the key ingredients of this formulation is Nilavembu, which is kalmake, Naval Param, which is Cesium cumini, Sindil, Tinospora cordifolia, and Pagal, which is Momordica charantia, and Korek Karandir, that is Cypress rotundus, and Sukku, which is Gingiber officine, and Milagu, Piper nigrum, and Adatoda vasica, and of course excipients are there. So it's in a tablet form. The formulation is created in a manner to ensure that we have done the scientific studies to establish the fact that organ protection is assured. We have done cell isolation of retinal cells, nerve cells, kidney cells, liver cells, and confirmed that the formulation has got a protective property, particularly in type 2 diabetes. So we have done a lot of research and publication on this, and we are happy to see that the doctors are beginning to see the long-term use of this drug, particularly in pre-diabetic and early diabetic stages, can prevent organ damage, which is inevitable in the case of diabetes patients. We have done a clinical study where we have compared D-COD tablets with vidagliptin and metformin formulations, and also with Madhumega Churnam, which is another SIDDHA formulation. And we've seen that the combination of conventional anti-diabetic drug, particularly used in allopathy, along with D-COD, ensures the blood sugar level fluctuation is reduced, and also the patient health in terms of feeling the health is in terms of the long-term health of the patient is very much in good shape. And individually, the D-COD drug is also effective in controlling and particularly stabilizing blood sugar levels. So both in combination and individually, the drug is proven to take care of the comorbidities and also balance the fluctuation in blood sugar levels. So this is in brief. I will be happy to share some of the publications and also details about this formulation. It's a 100% herbal Siddha proprietary formulation, and we have done a complete safety analysis of this formulation before introduction, and we are continuing to do more evaluation both from clinical as well as laboratory levels.
Thank you, sir. And the last question is about your 777 oil. What part is you are using of Rhytating Toria? Leaves or bark or
leaves.
the
See, the conventional preparation is with leaves, with the fresh leaves. Of course, there are other parts of Rhytating Toria which are documented, particularly the seed, Petpalai arisi, they say, that is also known to have therapeutic properties. We have analyzed different parts, and of course, the highest level of phytoconstituents are there in the leaf, and we have evolved the processing of this leaves in a proprietary manner to ensure that the best availability of all the phyto ingredients and the therapeutic ingredients are present in our formulation. So the biggest strength is, particularly in a good formulation, we see is the processing. It's not just adding the ingredients, so it's the right way in it. It's processed and making it therapeutically. Small things we take care. So particularly things like rancidity, and these are very common, particularly in oil preparations. So we've seen that many similar preparations, unfortunately, very basic things like this are not kept up, and therefore whatever be the goodness of the ingredients, the herbal ingredient fails when the base becomes unstable. So I hope I answered the question.
Yeah, thank you, sir. Thank you very much. Over to Pawanji. Thank you, Pawanji. Thank you very much.
Thank you, sir. We'll be happy to see our reach to Canada. Of course, Canadian laws have to be met, so we are trying hard to see whether in what aspect we can ensure that the regulatory aspect of medicinal formulations are met in Canada. And we'll be
Sir,
happy
very
to see.
very soon, a big research work is going to be started on Ayurvedic products by University Health Network in Canada. Our team is already in Delhi, so they are very much in touch with the AYUSH ministry. So they are selecting the fields and the medicines. So we will inform you, and
Thank you,
we are
sir.
very much interested for this diabetes formulation if they can take it up.
Thank you,
Because
sir.
there's the key area where the people are searching some sort of innovative products which are different from which are out of box, which are different from the mainstream medicines. So I'll definitely mention about it. I will also mention about your diabetes product to the team. Thank you, sir.
Thank you very much. Thank you very much, sir. Thanks for the time. I'm very honored to connect with you across the ocean, and I really salute you for taking our AYUSH systems to distant countries, and that's really a great service you're doing.
He has started Canadian College of Ayurveda there. So it is a great opportunity to spread Ayurveda and clinical research also. Dr. Satya is with us. You are with us. Really, we are unknown regarding this Siddha secrets. Please, my humble request again to both the speakers. I have sent you just now the remaining January webinar program. Please guide us, because we are inviting Unani, we are inviting yoga, we are inviting homeopathy, but the Siddha only. So
Pawan ji,
Satya ji, yes.
पवन जी, एक प्रोग्राम आप तमिल में करो, हम जरूर बहुत लोग आएंगे इसमें.
कब डेट
क्योंकि
प्लीज.
ये एक सबसे ज्यादा एक रिजर्वेशन है. मैं
दिस संडे
मैं ये बोल रहा
सर,
हूँ
Sir, this
अब
Sunday.
इस संडे अब सब 4 दिन छुट्टी पे एक माहौल में है तमिलनाडु।
सुनिए एक
पोंगल
काम करिए ना, आपका तमिलनाडु फाउंडेशन डे किस दिन है? हम उस
वो
दिन
अलग बात है, वो बात की बात है सर।
नहीं
वो बात की बात है, अभी तो हम रिसेंट बात कर
नहीं
रहे हैं।
हम ये कर रहे हैं कि अगर आप एक सेशन डिस्कशन, आई होप डॉक्टर सत्या विल अग्री विथ मी कि ऑन सिद्धा मैं I would like to say that to speak speak with authority and clarity in Hindi or English बहुत कम लोग होंगे, लेकिन आप अगर इंटरेक्शन प्लेटफॉर्म तमिल में रखेंगे तो डेफिनेटली अच्छे स्पीकर्स आने का संभव है। लेकिन ऑफ कोर्स ये इसको एक ट्रांसलेटर या समरी शुड बी देयर।
तो आप फिर एक तमिल स्पीकिंग एंकर दे दीजिएगा ना, जिससे थोड़ा सा कोऑर्डिनेट होता रहेगा।
और इंटरप्रेटर भी चाहिए सर, इंटरप्रेटर भी चाहिए।
नहीं, we don't need interpreter, sorry. We don't want to disturb the flow of the webinar. Whatever may be, that will be in local language. It is there that we will not understand, no problem. But the communication.
नहीं सजेशन है, अच्छे लोग हैं और उसको हम आई एम श्योर डॉक्टर सत्या इज इंटरेक्टिंग विद मोर पीपल देन personally I am
sir,
sure.
now sorry for interruption, sir. Sorry for the interruption. Actually, now we have some good speakers whom I may suggest, because we have around 10 to 20 doctors in Delhi itself working in Delhi, and definitely they will be helping the team for their needs. Sir, I will identify some and say to you, and I hope Sri Rajagopal is also having a very huge team with him, and they will definitely help you, sir, and we will definitely try to meet your requirements. Don't worry.
21st January, sir.
21st January, I will speak with my friends, and what's that? Actually, I have read your
Saturday.
I have read your PDF. Let me see. What's the date?
Saturday.
What's the title, sir?
Whatever you want. Both of you decide. Both of you decide. We are with you. We want to spread Siddha all over the country.
Okay, sir. I will try to ask somebody to represent Siddha on that day, and I will let you know tomorrow. Okay, thank you, sir.
Thank you. This is the humble request to Rajagopal ji also.
जरूर करेंगे सर। आप टायरलेसली आप हर रोज इतना प्रोग्राम आप कर रहे हो, रियली ऑल ऑफ यू, अग्निहोत्री जी और ऑल ऑफ यू, दिस इज समथिंग नॉट एट ऑल ऑर्डिनरी, वेरी डिफिकल्ट। इतने लोगों से आप कोऑर्डिनेट करके सबको एक प्लेटफॉर्म देके सब्जेक्ट क्रिएट करना भी इज अ बिग टास्क।
बस भोलेनाथ आइडिया देता है तो बस अकेला बैठ के सब्जेक्ट क्रिएट हो जाते हैं सर।
और आपका आवाज भी बहुत अच्छा है, इतना अच्छा आप गा रहे हो, और पहला जो भजन था ये वेरी वेरी मेस्मराइजिंग। थैंक यू।
Sir, can I ask somebody to speak on documentation of local health traditions, sir?
Documentation of
local health traditions, because you have marked that day for Vaidya Paramara.
Yes.
I will ask people to speak on documentation of local health traditions.
Definitely.
Will do.
QCI is also there. Anil Johri ji is there. QCI will also guide for this subject.
Okay, will do.
Ex-CEO of QCI is with us.
Yeah.
Please guide me your concept. We will definitely arrange that.
Okay, thank you.
This platform is yours, Dr. Satya ji and Rajagopal ji. Please consider my humble request with gratefulness. This platform is yours. Please use this platform for Satya Siddha.
Okay,
thank you.
It is absolutely non-commercial, non-promoting. When I was in Imami Jhandu, then also I was not putting Jhandu logo there. This is our non-commercial, definitely inspirational journey without any commercial use. And if you want any commercial webinar, that can be arranged separately. But AYUSH SAMRIDDHI is definitely, absolutely conceptualized as non-commercial. Thank you
sir.
very much. Now I would like to request Dr. C.P. Sharma ji, ex-Joint Director, Government of Ayush, Madhya Pradesh. Dr. C.P. Sharma ji is practicing in Gwalior, roaring practitioner. So I would like to request Dr. C.P. Sharma ji, if he is free, because we have guests from Assam also, and we have guests from Maharashtra also, Bihar also. I hope every state is covered, Bengal also, Dr. Jayesh Thakkar. So now Dr. C.P. Sharma ji, आदरणीय C.P. Sharma ji हमें सुन रहे हैं? आदरणीय C.P. Sharma ji from Gwalior. I hope I am not audible. Dr. Professor Nishant Shukla, a great legend from Ayurveda. He was professor of Gulab Kumarwa Ayurvedic College, Jamnagar, and he is the grandson of Dr. C.P. Shukla, who was the legend Ayurvedic physician from IPGTRS Jamnagar. Welcome, Nishantji, welcome. I hope you have also experienced some Siddha medicine in your practice till now.
Unfortunately, but
Kindly switch off your video, sir. Your net is weak. Kindly switch off your video. Your net is weak. Yes, sir.
जामनगर में सिद्धा का हेलो, is my voice audible?
Yes, loud and clear, sir. Your ojasvi awaaz, technology cannot interrupt. Welcome.
जामनगर मैंने सिद्ध का यूज जो है वो नहीं किया है. फंडामेंटली दोनों के प्रिंसिपल्स जो है वो इक्वल है, आयुर्वेद और सिद्ध के. और आयुर्वेद की जो पहली रिसर्च सेंटर जामनगर में हुई थी उसमें सिद्ध का भी जो है ये दैट वाज द इंटीग्रेटेड रिसर्च ऑन सिद्ध एंड आयुर्वेद. तो मेरा जो है वो एक्सपीरियंस खास जो है वो नहीं है. एक जामनगर में पिल्लाई जी करके थे, उनसे थोड़ा बहुत जो है ये संपर्क था. बाकी जो है वो सिद्धा का ज्ञान जो है वो मेरे पास नहीं है. जो फर्क पड़ता है वो मेडिसिन प्रोक्योरमेंट में, जो मेडिसिन प्रिपरेशन में और देन आफ्टर इट्स यूज, उसमें जो है ये फर्क पड़ता है. फंडामेंटली तो जो है वो करीब जो है वो एक समान ही रहता है. तो ये इतना ये जो है वो ज्ञान है. सिद्ध के बारे में मेरा कुछ भी जो है वो ज्ञान नहीं, यही जो है वो हकीकत है. और आज मुझे ये डेफिनेटली आई एम ग्लैड टू हियर एंड आई हैव जस्ट इम्प्रूव्ड माय नॉलेज, गेन्ड नॉलेज through the great scholars. Thank you very much, sir. आज आपने एक बार फिर से मुझे जो है वो विद्यार्थी बनने के लिए जो है वो योग्यता प्रदान की, उसके लिए आभार आपका. कुछ आज मैंने नया सीखा है.
बहुत अच्छा, बहुत अच्छा. मैं तो चाहूंगा कि आप सिद्धा प्रोडक्ट यूज करें, और जेआर के सिद्धा को मैं एडवोकेसी कर रहा हूं कि प्लीज ये नॉन कॉमर्शियल है टोटली, लेकिन मैंने यूज किए हैं और वो आयुर्वेद में असर थोड़ा अच्छे शायद फोकस्ड प्रोडक्ट नहीं थे, तो लेकिन सोरियासिस, एक्जिमा, ये इम्यूनिटी, ये बड़े गजब प्रोडक्ट है जेआर के सिद्धा के. एक रेंज है और मैं अकेली कंपनी मानता हूँ आयुर्वेद में, सॉरी आयुष में, जो अकेली स्किन प्रोडक्ट.
जामनगर में एक प्रोडक्ट आपने सोरियासिस का इसके लिए एक की जो है मैं बात कहूंगा. जामनगर में चंडमारुतम का यूज जो है वो काफी सारा होता था. चंडमारुतम,
अच्छा,
चंडमारुतम बेसिकली जो है वो वहां से जो है ये है. और चंडमारुतम का एक जो है इंटरनल यूज यादव जी त्रिकम जी आचार्य ने शायद ये बताया है. एक्सटर्नल यूज तो जो है ये हम सभी करते हैं चंडमारुतम का. उन्होंने
लेकिन वो ज्यादा पॉपुलर नहीं है.
वो नहीं पॉपुलर नहीं है, ये करना भी नहीं चाहिए. ये दिक्कत वाली ऐसी बात है कि उसमें अटोवर्ड रिएक्शन कब और कैसे हो सकते हैं, ये
बिल्कुल ठीक सर, बिल्कुल ठीक। आपकी आवाज एकदम
एक्सटर्नल एप्लीकेशन में जो है ये ठीक है।
निशांत जी, मैं राजगोपाल बोल रहा हूँ। बड़ी जल्द में हमारा एक सीनियर पर्सन आपसे मिलेगा जामनगर में, और आपके पास वक्त होगा तो हम ज़रूर सिद्धा और जो भी ट्रीटमेंट प्रोडक्ट्स है हमारा, आपको अगर वक्त आप देंगे तो आपसे बात करके एक शेयर करने का मौका मिलेगा तो अच्छी बात है। जरूर।
डेफिनेटली
थैंक यू
डेफिनेटली सर,
निशांत जी, थैंक यू वेरी
इट वुड बी
मच।
माय प्लेजर,
आपकी आवाज कट
इट
रही है
वुड बी
निशांत जी।
माय प्लेजर।
हमारा हमारा टीम है
ये
अहमदाबाद में हमारा टीम है। हम जरूर आप तक पहुंचेंगे उसको, और हमारा इच्छा है कि गुजरात में और जगह पर सिद्धा का जो प्रोडक्ट्स है हम पहुंच पाएंगे।
थैंक यू सर। नाउ आई वुड लाइक टू रिक्वेस्ट अगेन डॉक्टर सीपी शर्मा सर। डॉक्टर सीपी शर्मा जी, वेलकम 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 सर, वेलकम।
सर
Sir
प्रणाम
was
सर,
joint
नमस्कार।
director of AYUSH in Madhya Pradesh. He is roaring practitioner in Gwalior and very active person. President of Vishwa Ayurved person Madhya Pradesh. Welcome sir.
सर सर्वेभ्यो नमो नमः, सभी को नमस्कार। सर मेरा सिद्धा के मामले में केवल 3 प्रिपरेशंस पर एक छोटा सा एक्सपीरियंस है। ड्यूरिंग कोविड खावासूरा टैबलेट थी एक, उसके बड़े एक्सीलेंट रिजल्ट आए सर। खावासूरा क्वाथ भी था और खावासूरा टैबलेट। देन एक एपिलेप्सी में भी मैंने एक प्रयोग किया है सर। एपिलेप्सी में एक तैले ओनम शूडर तैलम, ये 2 मेरे सिद्धा के रूटीन प्रैक्टिस में प्रयोग किए हैं। खवासूरा के तो बहुत अच्छे रिजल्ट आए सर ड्यूरिंग कोविड और अपर रेस्पिरेटरी इन्फेक्शन।
But sir, it's very great to know that you have used one-on soda thalam. It was a drug which is not available in the market. It should be prepared and given to you. Somebody has done that job, and we have been doing some research on that to prove its anti-epileptic property. And thank you for that. Thank you for the information.
और शर्मा जी, हम भी चाहते हैं कि बड़ी जल्दी आप तक हम पहुंचेंगे। हमारा पहुंच अभी भोपाल तक आया है, और बड़ी जल्दी ग्वालियर में एक्चुअली हमारा एक टीम मेंबर था, वो अभी नहीं है, लेकिन आप जैसे बड़े डॉक्टर से अभी मौका नहीं मिला। बहुत जल्दी में हम आपसे टाइम लेके मिलेंगे और आपके सपोर्ट भी लेंगे। और
मेरे पास सर आपके ड्रग इंदौर के माध्यम से आते हैं। इंदौर में है मिस्टर पाराशर, वो आपका उनके पास डीलरशिप है, तो उनके माध्यम से एसकेएम के प्रिपरेशंस आते हैं। उसमें एसकेएम सिद्धा के कुछ अच्छे प्रिपरेशन रूटीन में इंट्रोड्यूस रहते हैं, वो लोग एक्सप्लेन करते रहते हैं। तो कई बार हमें आयुर्वेद के उनसे रिजल्ट नहीं मिल पाते, तो हम ट्राई करते हैं कि सिद्धा से शायद हमें कुछ चमत्कारिक मिरेक्लिक, तो वास्तव में चमत्कारिक रिजल्ट हमें उपलब्ध मिले। इसके लिए हम सिद्धा थेरेपी को बहुत बहुत और उसके जो फार्मेसीज हैं उन सबको धन्यवाद देते हैं कि वो और अच्छे प्रिपरेशन लाएं मार्केट में जो रिजल्ट ओरिएंटेड हो सके।
बहुत अच्छी बात है। थैंक यू फॉर सपोर्टिंग द सिस्टम।
थैंक यू। नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर साधना वाइकर, though she is from Maharashtra, but she is dean in same Ayurvedic college, Bhopal. Welcome, madam. Welcome,
हेलो,
madam.
नमस्कार सर। सर आवाज आ रही है?
हाँ, क्लियर लाउड। आपकी आवाज कोई रोक पाएगा?
नमस्कार सर। सर आज का जो सब्जेक्ट है सिद्धा एंड डाइट एंड आयुष, सिद्धा के बारे में मुझे इतना ज्यादा नहीं है, थोड़ा बहुत नॉलेज है। सिद्धा इन डाइट का तो उनका जो बेस होता है वो रसा के ऊपर होता है। षट रसात्मक जो हमारे आयुर्वेद में भी बताया गया है आहार, वही उनके उनका बेसिक जो है सिद्धांत जो है उसी के ऊपर है। इतना ही मैं कहना चाहूंगी, ज्यादा कुछ तो मुझे इनके बारे में अपन ने यूज भी नहीं किया है, मैंने कोई मेडिसिन या मुझे कोई उसके बारे में नॉलेज है। पर आपको धन्यवाद देना चाहूंगी कि आज का जो हमारा वेबिनार था उससे काफी सारी मदद हमें भी हुई है, क्योंकि हम चिकित्सक हैं और हम अलग अलग पैथी से भी जो भी अच्छी मेडिसिन से डायग्नोस करके हमें जो भी उससे चिकित्सा में हमें उपशय मिलता है तो उसे हमें अपनाना चाहिए। तो मैं धन्यवाद देना चाहूंगी कि आपका एक अच्छा सब्जेक्ट आपने हमारे सामने रखा है सबके सामने, और सिद्ध तक पहुंचने की हम भी कोशिश करेंगे। जो भी मेडिसिन जैसे इंदौर से भी मिलती है, और माननीय अपने सीपी शर्मा जी ने जो हमें कहा है कि उन्होंने जो मेडिसिन अपनाई है खावा सुरा, तो इसके बारे में और हम पढ़ के यदि उसका और यूज हम कर सके तो वो बहुत बड़ी बात होगी। इतना ही मैं आज के दिन में कहना चाहूंगी।
थैंक यू मैडम। मैं तो
और
ये
आपको
जानता हूँ मैडम, जब से एमडी किया जामनगर से 89 से,
सर,
उसके बाद जस्ट कलकत्ता में आया, और कलकत्ता में चूंकि ह्यूमिड वेदर है तो यहाँ सोरियासिस और एक्जिमा के भरपूर पेशेंट है,
जी सर,
भरपूर। तो मैंने जब आयुर्वेद ट्रीट किया तो इंटरनल ब्लड प्यूरिफायर तो आयुर्वेद का देता रहा, लेकिन एक्सटर्नल में जेआर के सिद्धा सेवा ड्रॉप्स भी है इनकी, टोलेनोर, वहां ल्यूकोडर्मा, कौन सा प्रोडक्ट ल्यूकोडर्मा में अपना इफेक्टिव है वो नहीं समझ पाया। मैं आयुर्वेद का ही हूं, लेकिन फिर भी मैंने टोलेनोर, 777 ऑयल, लिप्पू, सेवा ड्रॉप्स, ये मैं इनकी मतलब पब्लिसिटी नहीं कर रहा हूँ, आई एम फैन ऑफ दैट, आई एम फैन ऑफ दैट, so please use that, I'm really fan of that.
Thank you, sir.
सर
Thank you.
कलकत्ता में तो एटमॉस्फेयर के साथ साथ उनका डाइट भी है ना, स्किन डिसीज के लिए उनकी जवाबदारी तो डाइट भी है।
पूरा
और
पूरा सब मछली के साथ सब कुछ खा लेते हैं, दूध
फिश
वगैरह
के
सब
साथ
कुछ।
दूध दही से लेके सब कुछ लेते हैं, छेना से लेके
हाँ,
सब कुछ, तो वो
सब
उसके
कुछ
लिए भी
खाते हैं, सब
जवाबदार है।
कुछ।
मतलब
थैंक यू
वातावरण
मैडम,
वहाँ का एटमॉस्फेयर और डाइट उनका।
थैंक यू मैडम। नाउ we move to Telangana. Dr. Jagdishwar Dom is with us from Telangana, very senior respected doctor. I hope he is the spiritual person, doctor, motivator, inspiring person, Dr. Jagdishwar ji. Am I
Sir,
audible to you?
excuse me, sir. Sorry for the interruption, sir. Sir,
Sorry.
I am having a travel by 10:30, so
Okay.
I want to make a leave, and thank you, Dr. Rajagopalan, Mr. Rajagopalan sir, for sharing with me the day, and once again I share my gratitude to every one of you for giving us an opportunity. And Madam has asked about the taste concept. I have put some material in the chat box which Madam can use. Thank you, sir. Thank you very much.
Thank you, but my humble request again, I have sent you the rest of January webinar program. Kindly introduce new latent Pratibhaएं.
Will do. Definitely will do. Thank you.
Nice.
Thank
Nice. Thank you, ji. Now, as a last opinion of two persons, Bihar, Dr. Dineshwar Prasad, welcome. Dineshwar ji, welcome.
धन्यवाद सर। हाँ, धन्यवाद सर। जो है ये JRK का मैं करीब 10 सालों से यूज कर रहा हूँ, आपको और सीमा ड्रॉप्स।
आप अपना वीडियो बंद कर दीजिए दिनेश्वर जी, एक कृपा कीजिए, वीडियो बंद कर दीजिए आपकी। हाँ,
एक मिनट सर जी।
हाँ, अब आवाज आ रही है, बोलिए प्लीज। म्यूट है आप, म्यूट है, काइंडली अनम्यूट। यस
जी, आ रहा है।
हाँ, क्लियर
जी। तो वही सर हमने बताया कि हम 10 सालों से करीब JRK का प्रोडक्ट यूज कर रहे हैं, और स्पेशली सोरायसिस में 777 का बहुत अच्छा रिजल्ट रहा है। मैं सीबा का भी प्रयोग, मुझे सीबा ड्रॉप का भी प्रयोग करते रहा हूँ, और इनकी जो भी स्किन का प्रोडक्ट है वो एक्चुअल माने बहुत मार्वेलस है जो है, और इसका प्रचार प्रसार होना चाहिए। हमारे यहाँ तो काफी इजीली अवेलेबल बिहार में है, आपको पटना में जो है, अभी दरभंगा में भी हम है, तो दरभंगा में भी कुछ मेडिसिन मिल जा रही हैं। तो मैं उनको धन्यवाद देना चाहूंगा जीआर के मैनेजमेंट को।
आपको धन्यवाद हमारी तरफ से, और आप जैसे महान प्रैक्टिशनर्स हमें सपोर्ट किया है, और सिद्धा सिस्टम का जो पहचान है आपके द्वारा पब्लिक का हो रहा है, ये बहुत हमारा खुशी की बात है। और हम एक जॉइंट एफर्ट से लोगों का भलाई हम करेंगे, तो कॉन्फिडेंस इन
निश्चित रूप से हम
इंडियंस।
चाहेंगे कि सर, हाँ, कोई कैंप लगा करके बीच बीच में, आपके द्वारा हमने सजेस्ट किया था आपके लोगों को कि ये स्किन का केसेज बिहार में भी बहुत है, तो कोई कैंप लगा करके बीच बीच में अगर किया जाए तो काफी अच्छा रिजल्ट मिल सकता है।
जरूर जरूर करेंगे।
थैंक यू दिनेश्वर जी। नाउ आई वुड लाइक टू रिक्वेस्ट डॉक्टर नीलाक्षी देव चौधरी जी फ्रॉम आसाम। वेलकम डॉक्टर नीलाक्षी जी, वेलकम। Am I audible to you, Dr. Nilakshi ji? Last 2 opinions are left. Within 10 minutes, we will wind up.
Good evening, sir. I'm audible. You're audible,
yes,
sir.
Clear, madam.
Yeah, SIDDHA medicines, which you explained on for psoriasis, is really great. In Assam also, we are using 777 oil, Tolunarm, and it really works very well.
Thank you, sir.
Thank you very much. Thank you very much, madam.
Thank you.
In the last, I would like to request Professor V.K. Jagdishwar ji again. Jagdishwar ji from Telangana. Jagdishwar ji, Telangana is leaving left. Welcome. If you are in awakened condition, kindly welcome. I hope he is not in the position. He is in the bed, I hope, too late. So I would like to request for his valedictory blessings, Professor V.K. Agnihotri.
Thank you, Professor Pawan Sharma ji, and our respect to all the distinguished guest speakers, along with the good discussions, guys. Especially this discussion started with Dr. Harish Sharma ji and reached to Raja Gopal ji and also SIDDHA ji. I think I extend our thanks to especially these 3 persons, and then the open discussion started, which almost got say speed with Dr. C.P. Sharma ji, Dr. Nishant Sharma ji, our Sadhna Vaikar ji, madam, and also Nilakshi Dev ji, Dinesh Sharma ji. What I found that since it became Ayush, that I have got all privilege and proud to say that SIDDHA is ours. It's very difficult to say that SIDDHA is being represented by SIDDHA experts. But since we are all part and parcel of our Ayush, so SIDDHA is ours. And probably Dr. C.P. Sharma sir, he really saved our prestige of Ayurvedic practitioners, that he named preparations like Khapsura Quath and Khapsura tablets during the COVID pandemic. So this is what our approach is. Otherwise, we got repeatedly usefulness of 777 oil in case of psoriasis or skin disorders in general. So we are all indebted with the SIDDHA preparations, especially they have got a very good results. But the fact is, the circulation of these medicines are little bit limited. So we know, but regular supply or demand is a little bit having still a chance to increase. But the promptness shown by our Rajagopalaji, that he is just near to reach Jamnagar, to Bhopal, to Gwalior. It is really, and Delhi, it is really giving us so satisfaction that
Haridwar already posted.
Yeah, of course. Thank you so much. Of course, if you come here, as Professor Pawanji telling, 15 colleges are there in Bhopal, one city, 11 colleges in one city, Haridwar Ayurvedic College, and of course 13 colleges in there in Dehradun. So we have got 19-20 colleges, including 3 government colleges in that way. So we have got a much more thrust area where the product of the SIDDHA will be accepted and put in practice. So with these words, that all
Thank
the
you,
discussions
sir.
was positive, all the speakers were positive, and
Right.
we pleased to have our SIDDHA day today. Thank you so much. Over to Pawan Sharma ji.
So tomorrow's webinar, sir, I would like to inform, is on Ayurveda for Youth Development. Swami Yogi Rajneesh from Haridwar, Pranjal Joshi from Anand, Mrinal Akre from Rajkot, and Madam Parul Joshi from Gandhinagar. All will be guiding us. In between, Lori will be there. Otherwise, we are conducting, as I am National Executive and State Convener of Vishwa Ayurved Parishad, we are conducting with Senior Executive of Vishwa Ayurved Parishad 14th Vishwa Mangalya Divas. On 13th, we will be doing our webinar on Lohri, and then Pongal we would like to do. So this is Ghar Ghar Ayurved, Har Ghar Ayurved. ये अभी गवर्नमेंट ने लिया है, ये हमारी आयुष समृद्धि पिछले 2.5 साल से इसी भावना को लेकर काम कर रही है कि हम कैसे किसी भी चीज को अपने आयुष से रिलेट करें. So really thankful, rather grateful, obliged, and really sincere regards to you all for joining. Kindly do join tomorrow also. Tomorrow time is slight changed, 6 p.m. and please join us. राजगोपाल जी, आपसे पुनः प्रार्थना है कि आप हमें नए टैलेंट दीजिए. आप पे तो सिद्धा डॉक्टर होंगे, तो हम चाहते हैं कि एक भी वेबिनार हमारी सिद्धा के कंपोनेंट के बिना ना जाए. AYUSH पूरे हो जाए हमारे, तो बस हम सुखी. So nice of you. Thank you.
Thank you, sir. Thank you very much. Thank you all the doctors and
सबको नमस्कार, सबको धन्यवाद, शुभ रात्रि.
Thank you.
Good night.
good night.